than two-thirds of American families have been affected by addiction. In 2015, there had been 21,101 opioid overdose-related deaths, 12,990 of those related to heroin. Death rates have been on a steady increase since then. Recently, there have been new developments on how to tackle this disease. No one really knows why people begin using drugs, heroin in particular, and continue to use throughout their lifetime. Interviewee Dr. Neunzig contributes her thoughts.
I'm a licensed psychologist and service director at a state-operated clinic. I have been working in mental health for about 20 years now and work predominantly with an adult population who lives with chronic mental illness as well as addiction. Interestingly, heroin is one of those drugs that research has shown alleviates symptoms the most. I'm always continuously surprised by how addiction strikes anyone at various times in the life cycle. A lot of the individuals that I meet have been struggling with addiction for a very long time. Many folks living with depression, anxiety, some with trauma histories, some who've had just unfortunate life experiences, and most of them found addiction as a way to self-medicate, so to speak.
The way heroin addiction and addiction in general has been viewed in the past was as a choice. More recently, outlooks have been centered around addiction being treated as a disease.
So basically, I am a resident doctor, meaning that I graduated in medical school in 2014, and I'm in a residency program specializing in psychiatry. Heroin and all sorts of substance abuse there's a big turn to look at it more of a disease process rather than kind of a choice that people make, because no one wakes up in the morning saying, oh, I want to be addicted to heroin today. No one chooses that lifestyle. No one wants that to be their lifestyle. So the biggest change I could see, with how people are viewing it is that they're viewing it as a disease process rather than viewing it as a choice that a person is making.
Throughout the news and in films, addicts have been represented as aimless creatures and less as humans. This does no justice to those Dr. Neunzig speaks of.
Sadly, though, I haven't found a single film or depiction that really represents the diversity of individuals who are impacted by heroin addiction. There are some really great movies, starting with one that Frank Sinatra did many years ago that talk about how individuals in recovery make such a commitment and work so hard towards being drug-free.
In recent years, there have been developments in treatment for addiction.
Years ago, the most popular form of treatment for opiate addiction was methadone clinic. Methadone's tough because it requires daily dosing. With the development of other drugs like Suboxone and Subzol, most clients who are recovering from their addiction can visit their provider on a monthly basis. In recent years too, there's been some exciting new models that have surfaced. One is called the harm reduction model, which is rather than focusing on abstinence from the drug, we work to reduce the dangers inherent in the drug. Families are also particularly influential in helping their loved ones to recover, and agencies such as SAMHSA has been particularly helpful in providing education, outreach, and connecting individuals to services in recent years.
We basically want to treat the disease, and by treating the disease, we help kind of mitigate all those other bad things that are happening in their lives because of the substance.
Despite medication-based treatments, outreach and support are major aspects during the recovery process.
If you know someone that's struggling with addiction or someone is struggling with addiction around you, the first thing that I would recommend for them to do is definitely just tell someone, tell your family, tell your friends, tell someone that you can rely on.
As far as what you can do to help, ending ignorance is a major step. Recovery is in reach, more so now than ever with the new perspective on addiction, new treatments, and new knowledge on connections between addiction and mental illness.